Here's a critical confounding factor that's being almost completely ignored in discussions about cancer diagnoses coinciding with vaccination. The pandemic caused massive disruptions to cancer screening and diagnosis, creating a backlog that emerged precisely as vaccine rollouts began. This is pure temporal correlation being mistaken for causation. During the early pandemic, healthcare systems essentially paused all non-urgent medical services. Mammography centers closed. Colonoscopy suites went dark. Dermatologists stopped doing routine skin checks. People with concerning symptoms often avoided seeking care, terrified of COVID exposure in medical facilities. This wasn't brief. In many places, screening disruptions lasted over a year. And during that entire time, cancers didn't stop developing. Think about what this means practically. A woman who would normally have gotten a mammogram in March 2020 detecting early-stage breast cancer instead had her appointment canceled. That cancer continued growing, undetected. By the time screening resumed in 2021 or 2022, it had advanced to a later stage. Multiply this across millions of delayed screenings, and you create an enormous backlog of undiagnosed cancers. The documented consequences are stark. Numerous studies have shown that cancers diagnosed in 2022 and 2023 were frequently at more advanced stages compared to pre-pandemic diagnoses. These weren't new cancers caused by some pandemic-era factor. They were existing cancers that would have been caught earlier if screening had continued normally. The tumors were there in 2020. We just didn't find them until later. This creates perfect conditions for false causal attribution. Vaccines rolled out massively in 2021. Healthcare services normalized around the same time. The screening backlog cleared, producing a surge in cancer diagnoses. These two trends, vaccination and cancer diagnosis, both increased simultaneously but completely independently. Yet to someone not understanding the confounding, it looks like vaccination caused the cancer surge. Epidemiologically, this is a classic example of confounding by indication and timing. The same period that saw mass vaccination also saw the resumption of medical services after unprecedented disruption. Separating these effects requires careful analysis of screening rates, stage at diagnosis, and comparison to expected trends based on pre-pandemic patterns. When researchers have done this analysis, the picture becomes clear. Cancer diagnosis rates show patterns entirely consistent with screening disruption and resumption. The surge appears primarily in screen-detected cancers, not in cancers that present symptomatically regardless of screening. Stage at diagnosis shifted toward later stages during the screening gap and began normalizing as screening resumed. These patterns are what we'd expect from detection bias due to healthcare disruption, not from new disease emergence. The real tragedy here is profound, but it's not about vaccines. It's about delayed diagnoses leading to worse outcomes. Some patients whose cancers would have been highly treatable if caught in early 2020 instead had advanced disease by the time of diagnosis 2 years later. Treatment became more difficult, prognosis worsened, and in some cases, lives were lost that could have been saved by earlier detection. But blaming vaccines for this diverts attention from the actual problem, the critical importance of maintaining screening continuity during public health emergencies. We need to learn how to protect cancer screening programs even during crises, how to help people feel safe seeking necessary medical care, and how to manage screening backlogs effectively when disruptions occur. Misattributing the delayed diagnosis problem to vaccines doesn't just spread misinformation. It prevents us from addressing the real cause and implementing solutions that could prevent similar harms in future public health emergencies. Understanding confounding is essential for identifying true causes and developing effective interventions.